If you're on a Medicare Advantage plan right now, I need you to pay attention because your plan could disappear in 2027. And I don't say that to scare you. This year alone, about 2.6 million people opened a letter telling them their Medicare Advantage plan was being terminated. That's roughly 1 in every 10 Advantage members, forced to find new coverage whether they wanted to or not. To put that in perspective, from 2018 through 2024, only about 1% of members lost their plan in a typical year. This year it jumped to around 10%. And the insurance companies are already signaling more of the same for 2027. So today, we're going to settle the question that millions of retirees are being forced to answer this fall: Medicare Advantage versus Medicare Supplement. Which one actually protects you? I'll give you my honest take, real numbers, and stick with me to the end, because there's a trap in switching between these two that nobody explains until it's too late, and it can cost you the coverage you're counting on. Let's start with the plain English difference, because the names are confusing on purpose. Medicare Advantage, also called Part C, is a private plan that replaces original Medicare and bundles your hospital, your medical, and usually your drug coverage into one card. The premiums are often low. Sometimes they advertise $0 a month. And many plans throw in extras: dental, vision, hearing aids, even a gym membership. On the surface, that sounds like a great deal. And in your healthy years, it can be. But here's what the brochure doesn't put in big letters. You are locked into their network of doctors and hospitals. Step outside that network, and you could pay full price, or not be covered at all. You often need referrals to see a specialist, and prior approval before the plan agrees to pay. And every time you actually use it, a doctor visit, a test, a hospital stay, you pay a copay. Those copays are quiet in a healthy year. But the year you get sick, they stack up fast, and there is a yearly ceiling, but that ceiling can be thousands of dollars. Now, a Medicare Supplement plan, also called Medigap, works in a completely different way. You keep original Medicare, and the Medigap policy sits on top and pays the gaps that Medicare leaves behind: the deductibles, the co-insurance, the copays. Yes, you pay a higher monthly premium for that, depending on where you live and which plan letter you choose. But in return, you can walk into almost any doctor or hospital in the country that accepts Medicare. No network. No referrals. And when that big hospital bill comes, most of it, sometimes all of it, is already handled. Your costs are steady and predictable, month after month. Let me make this real with a simple example. Say you have a rough year. A hospital stay, some specialists, a procedure. On many Advantage plans, you could be looking at daily hospital copays, specialist copays, and out-of-pocket costs that climb towards several $1,000s before your plan's yearly limit kicks in. On a Medigap plan, after your monthly premium, that same year might cost you very little out of pocket because the plan is designed to cover those gaps. So the real question isn't which one is cheaper this month. It's which one you'd rather have the year your health takes a turn. And none of us get to schedule that year. In the next part, I'm going to show you exactly why these Advantage plans are closing, the denial problem almost nobody talks about, and the switching trap that can leave you stuck. Stay with me. So why are these Advantage plans suddenly closing? The answer is simpler than the insurance companies would like to admit. They ran the numbers, decided certain plans weren't profitable enough, and pulled out of entire counties, all at once. This isn't about your health or how loyal a customer you've been. It's about their bottom line. And the damage wasn't spread evenly. In 7 states this year, more than 40% of Advantage members lost their plan. In Vermont, it was over 90%. Imagine being a retiree in a small town and nearly every Advantage plan around you just vanishes. That's the reality a lot of people are waking up to. But even if your plan survives, there's a quieter problem worth understanding: denials and prior authorization. On Advantage plans, before the insurer pays for certain care, a hospital stay, a rehab facility, an expensive scan, they can require approval first. And sometimes that approval is delayed or denied right when you or your spouse needs care the most. You can appeal, and many appeals succeed, but that's a fight you're having from a hospital bed. With original Medicare and a Medigap plan, that layer of gatekeeping mostly isn't there. If Medicare covers it, your Medigap plan follows along. For a lot of retirees, that peace of mind is the whole point. Now here's the part one promised you. The trap. When you first turn 65, you get a one-time window, about 6 months, where a Medigap company must sell you a plan, no matter how sick you are. No health questions. Guaranteed. But once that window closes, in most states, if you later want to leave Advantage and switch to a Medigap plan, the insurance company can look at your full health history. And they can charge you more, or turn you down flat. Let that sink in. You could try to escape a shrinking Advantage plan at 72, after a heart procedure or a cancer scare, only to find out no Medigap plan will take you. That's why the choice you make this fall matters so much more than the premium printed on the brochure. You're not just choosing coverage for next year. You may be choosing whether the door back to Medigap stays open at all. There's one more piece of the puzzle, your drug coverage. Part D plans, the ones that pay for your prescriptions, also change every single year. Plans get discontinued, drugs move to different tiers, and pharmacies drop in and out of networks. So even if you love your plan today, the plan you have in 2027 may not be the plan you signed up for. That's exactly why you can't set it and forget it. So what should you actually do before the deadline? Medicare's annual enrollment runs from October 15th through December 7th. That's your window to change course for 2027. Here's a simple way to think about it. 1. If your plan is being terminated, do not ignore that letter. A termination can open a special window with guaranteed rights to a Medigap plan, but only if you act in time. 2. If you're healthy, you travel, or you want the freedom to see any doctor without asking permission, and you can afford the higher premium, Medigap buys you peace of mind that's hard to price. 3. If money is tight month to month and you're comfortable staying in a network, Advantage can still work, as long as you go in with eyes open, knowing you're betting on staying healthy. And 4. Whatever you lean toward, actually compare the specific plans in your zip code every single year. The right answer can change. One last thing, and it's important. I'm not a financial advisor or an insurance agent, and I can't see your specific situation. Before you make any move, talk to your state's SHIP counselor. That's the State Health Insurance Assistance Program. They give free, unbiased help, they don't sell anything, and they can compare your exact plans with you side by side. If this cleared things up, do me one favor and hit that subscribe button, because the enrollment tricks the insurance companies are quietly hoping you'll miss, I'm covering every one of them this season. Take care of yourself, look out for the people you love, and I'll see you in the next one.